Hello, and thank you for giving me the opportunity to say a few words at your event across the integrated care system. I'm Amar. I'm a clinician by background, a forensic psychiatrist. I'm the Chief Quality Officer at East London NHS Foundation Trust, where I've led the quality journey for about 12 years, and the National Clinical Director for Improvement at NHS England. Um, I am really pleased to see the progress that you're making across the system with adopting and embedding improvement, which is in line with the NHS Impact Framework, which was published last year by Amanda Pritchard in NHS England. The use of improvement has really moved on a long way in the 10 years since we first began applying continuous improvement in my own organisation in East London. Many healthcare organisations across England have now seen the benefit of applying a systematic approach to solving complex problems. Of course, it takes a long time to get to a place where improvement as a method and a way of thinking is really embedded in an organization. So it's so pleasing to see the progress you've already made across the system. Over the last few months, I've been meeting with organizations across the country, and I've been really pleased to meet with many of your trusts and to see the progress you've already made in adopting and embedding a continuous improvement approach. Of course, it's quite hard to make this shift as a healthcare provider because it means we're having to devolve power. It means we're having to equip our staff and patients to work together to solve complex problems, and that's not the way in which the healthcare system has traditionally been run. I guess going forward, looking at what the next few years holds for us in the NHS, there are a number of really big, wicked problems for us to solve, and I'm not convinced that the answer to this is more grip and control and assurance. I'm not sure what your view is on this, but I think perhaps the really big complex problems we're facing are going to need a whole range of creative solutions and people to be innovative and try new things. And that's exactly what a quality improvement approach offers. Of course, to be able to do that at scale means a very different mindset as a leader, shifting from one in which we view ourselves as problem solvers. And I wonder how many of you in executive roles find yourself faced with problems and feeling like you have to solve them. And I think we have to make that shift from problem solving to problem framing and really encourage through curiosity and good questioning and inquisition the ability for our teams to be able to think about the system in which they're working, the problems they're grappling with, and to see what solutions they might have. Of course, that alone won't be enough. We have to create the environment in which innovation and improvement can flourish. And that needs permission. It needs leaders to give permission for people to try new things. It also needs us to create an infrastructure to enable improvement at scale. The command and control hierarchical structures that are very strong in healthcare are very good for cascading information up and down, but less good at innovation and improvement. And we need to build a support structure around our teams as they apply continuous improvement in practice. And many organizations who've been on this journey now for many years have seen the benefits of this, not just in terms of quality of care, but in all domains of performance, from workforce figures to financial figures and operational figures too. And I guess it takes a little bit of faith as a board to be able to say that this is the way in which we want to move forwards. But I strongly believe that it is the best way for us to meet both the quality, the productivity, the workforce, and the financial challenges that we are facing today. And I hope that you've already seen the benefit from your own organizations of applying this, with teams coming up with amazing stories of success that we probably would not have thought about, on ideas that they've tried out, which we would not have thought about from the executive team or from the board level. And that's the real beauty of applying improvement. So my message to you is to really support this direction, give some thought to how you as a board are going to adopt this way of thinking. It needs a shift at the board, as I've seen here at Elford over the last decade, to become a continuously improving board, and how you seek assurance will change. How the executive team will operate will change too, as you start to introduce standard work as executives, as you start to apply a systematic but consistent problem-solving approach that your teams can apply, and your job becomes more of a coach and a problem framer, and really making sure that teams are doing what they can within their influence to be able to improve the system they work in. It will yield great results. Even within a year or two, you'd be able to see, if you do this well, improvements in your workforce satisfaction and engagement, as we did back in 2014 when we began this journey, And you'll be able to see team level results very quickly too. It may take you 2 or 3 years to get to the trust-wide level improvements that you'll be aspiring to, but it's a journey that is well worth undertaking from my own experience. So I hope you have a wonderful day today. Thank you for giving me the opportunity to say a few words, and I just wanted to commend you on the progress you've all made already in adopting improvement across the system, and we're here from the national team to support you with that effort in the future. Thank you.